Hi everybody, it's Joanne here, and today I'm going to have a word with you about movement as an assessment, something to help us with our diagnosis, our understanding of why the patient is presenting the way they are. Now, there are lots of different ways, of course, to use movement in evaluation, and there are some which put forward a certain specific set of tests that they would do with everybody. We don't tend to do that so much with JEMS. So we're very interested in what somebody needs to be able to do. And then asking a really specific and critical question. And that question is, why is this injured area under pressure? Now, if we approach it in this way, we're going to be looking for slightly different things. So if I just take two of the really basic elements, I might be looking for whether the structure is under pressure because it is bearing more load than other areas in the body, or I could be looking at it because it's being asked to move more than other areas in the body. So these are just two elements. But if we take those two and just use them as examples. So for example, if I have somebody who comes with anterior hip pain and they tell me they're doing lots of yoga, they're doing lots of back bends, and I have a look at their hip extension, I look at their back extension, and I realize that actually they don't have much in the way of spinal contribution to the motion, and the brain is trying to make it happen. So it's giving a little bit more anterior glide in that head of femur. So we're ending up with this anterior hip pain. So I'm saying, okay, so we have a structure that's under pressure because it's being asked to move more in proportion to what's around it. So am I going to actually put my efforts into doing something to the hip, or am I going to work on how to take the pressure off it by optimizing other elements in the kinetic chain? So it's a very simple example. Or let's say, for example, we're looking at the lower limb and we notice that the person performs their functions. Let's say they're coming downstairs and we notice there's a lot of knee bend, but there's very little happening in the hip. So we can see, okay, the knee's under a lot more pressure because actually the hip, which is a major joint, isn't contributing. So where's my effort going to go? Well, it's probably not going to go towards the knee. The knee's doing everything it can, but if I actually look at optimizing what's happening with the hip, I can reduce some of that pressure on the knee. And indeed, that's something we frequently do for people who have struggles going down hills. Or I could look at the upper limb. People who come with wrist, elbow, and shoulder problems, over UC type presentations. Now for them, I'm going to say, why is the structure under pressure? And I'm interested in another principle, which is how do they create force? So it's not uncommon for me to see someone like that, let's say a tennis player, and I realize that they're actually generating the majority of their force using their arm, which is actually quite small in terms of structure, when they could actually be generating it from the lower body and transferring it through the body and funneling it out through the arm and eventually through the hand to the racket. So I'm not going to spend masses of time treating the breakdown point. This is just the area that's telling us that we're not managing force as well. But I do want to know how I can take the pressure off it. So in this case, it's going to be me looking at how somebody can reconnect with their global movement. So when we assess, I'm keeping this very critical question in mind. Why is this structure under pressure? I'm going to select movements that are relevant to what that person actually does, which means it will be different from person to person. And I'm going to look at some very basic questions, like these first two. Is that area taking more load? In which case, how do I help the body find other alternatives? Or is it actually having to move too much because other areas of the body are similarly not playing their part? And that already starts to guide and shape my treatment pathway. Now, what's lovely about that is it also gives you a really meaningful way to explain it to the patient. A way that's very simple, something that they can take ownership of and easily explain to others, so maybe their family at home. Now, when they take that kind of power, then it makes sense of anything you give them, and bearing in mind that strength is useful, but often What I'm talking about here, it's about actually finding the other components in the global kinetic chain that will help them to take the pressure off that local area of pain. So if you're thinking about movement testing, I'm just going to encourage you to look at what you already use now and ask yourself the question, does it tell me why that area is under pressure? Or does it just tell me that they can't perform that movement? In which case, we're going to have to go further to find something that is adequately specific to form your treatment program. So stay tuned. These are some of the things that we discuss in GEMS, and I'll see if I can drop a few other little gems your way over the next few days. Bye for now.